over the anatomy. So we're looking at the posterior view here. You can see the epiglottis. Superior to that, you should expect to see the hyoid bone. It doesn't always come with laryngectomy specimens, but quite commonly does. Area epiglottic fold, pretty hard to demonstrate in a diagram, so I did bring a human larynx, which we will look at to go over the anatomy again. And you have your cuneiform tubercle, which is the most superior and anterior tubercle, and then inferior and sort of posterior to that is your corniculate tubercle, both of which are composed of the arytenoid cartilage. If you look at it from this anterior view, you should see your thyroid cartilage, and then depending on how far along the cancer has progressed, you may also receive a thyroid gland with it, and so then you would expect that to be here, of course. The number of tracheal rings will vary depending on where the lesion's located. So those are kind of the main anatomic structures that I want you to know as far as from that diagram. So now we're going to go to the actual human. Here you have your epiglottis, and you can see, although this is quite fixed, you do see the mucosa covering that epiglottis. To see if there's anything else. Okay, so remember, pre-epiglottic space, we have our epiglottis here, and then lateral to that on both sides we have our area epiglottic fold. Okay, and so since we have it open here, what you can see lateral to that now is your piriform sinus. And so that's, again, one of those other spaces that as a PA you should be looking at to make sure that the tumor isn't invading into, because that can be indicative of local extension. And then again, you can see it here on this side. So now we're going to kind of close it back up. And at this point, you should be able to appreciate your cuneiform tubercle here, and then your corniculate tubercle. Then again, remember, those are your arytenoid cartilage. And so when you're trying to take that section, I guess we'll talk about this a little bit later, but this is that sort of area where you're going to want to take your area epiglottic fold and our arytenoid cartilage section from. So now we've opened up the larynx, and I'll go through the anatomic structures and then the regions. So again, remember here you have your false chord, right? And then if you go deep all the way here in the ventricle, the most deep portion of that is the anterior commissure. And so that's that anterior attachment of the cords. Another space, again, that you need to be concerned about. Lateral to that is your, so again, this is the ventricle. And then lateral to that anterior commissure, you'll have your paraepiglottic space. Another one of those spaces. So remember, that's anterior to the cords and posterior to the thyroid cartilage. Now here you have your true cord, and your true cord is part of that glottic region, which I'll review in a moment. And then inferior to that's your subglottis. So now let's go through the regions. So remember, this is portion of your supraglottis, and your supraglottis is composed of basically everything superior to the ventricle. Your glottis is 1 centimeter, so about where my ruler was at, or my forceps. So yeah, just about that 1 centimeter below the glottis, or below the ventricle is the glottis, and then below to that, inferior to that is the subglottis. Here you have your cricoid cartilage, or cricoid, vocalis muscle, and then can't really see it too well because it's covered by a lot of soft tissue, but what I'm grabbing here is the thyroid cartilage. So those are all structures that you need to be aware of when you are looking at your specimens. Okay, so let me just review that again. You have your pre-epiglottic space, epiglottis, area epiglottic folds, piriform sinuses, cuneiform and corniculate tubercles, false cord, true cord, ventricle, and then you have your supraglottis, glottis, and subglottis, or infraglottic space. And then you have your cricoid cartilage, thyroid cartilage. So those are kind of the main structures that you'll need to be concerned about.